Hello, everyone. Hello, hello, hello. Thank you again for taking some time out of your Sunday afternoon to come be with us and talk about caring for yourself while caring for others. My name is Camila McLean Samuel, and I'm the host today. But before we get started, I just wanted to recite our land acknowledgement. The clinic team deems it important to acknowledge the stolen land on which we reside. In light of the topic of our clinic today, which is about mental health, we deem it important to acknowledge the institutional racism that exists in healthcare towards Indigenous and Black people. I acknowledge that the land that I am on is the territory of many nations, including the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is home to many diverse First Nations, Inuit, and Métis people. Since we are virtual, I would encourage everyone else to acknowledge that they are also on sacred land that is subject to many treaties, and encourage people to look up the individual land that they live on. Thank you. Just a bit of clinic housekeeping. So first of all, just want to notify everyone that we are recording this session. The reason why we're recording this session is to make sure that other people who may need this information can see it in the long run. So you guys get to be here in the moment, ask your questions, but there might be some people down the road who weren't able to come or just didn't know about it this first time around, and they would like to hear about it, especially if you go out and tell people about this wonderful information that you've received here. So we are recording this session so that it could be put up on our site so that others can view it. Please note that if you're going to be asking any questions and you want to turn on the camera, or if you want to verbally say it instead of it being read out, that you will be also part of this recording. So please make note of that. You can use the chat. So after I'm finished here, I'm going to change my name to send questions here. You can send the chat to either myself or Nadeisha, who is our speaker for today. But if you prefer to directly send the questions to the facilitator, you can also do that as well. We will be stopping for questions just before our break. So we will have a break today. So we will be stopping for questions then and at the end, at the very end of the program. So you'll have 2 times to ask questions. Okay, so let me just introduce our speaker for today. Nadeisha Pinnock was born and raised in Toronto and is of Jamaican heritage. She has worked in mental health nursing for over 10 years. She has gained experience in supporting adults, children, and transitional aged youth affected by mental illnesses or disorders to navigate the mental health system. As a mental health and addictions nurse, she is passionate about the provision of equitable and accessible mental health and an advocate for racially and culturally competent healthcare. In addition to her current position, she is also an active member on a number of organizational committees, including the CMHA, so that's Canadian Mental Health Association, Peel Board, and she is also the owner of a virtual bake shop, Sweet Homage, a Caribbean-inspired dessert shop. Outside of the office, Nadeisha is pursuing her dream of becoming a published novelist, where she is applying her knowledge to reach Black youth and reduce the stigma surrounding mental health. So hopefully one day you'll have a book along with this presentation to take home from Nadeisha. Now, before I hand it over to Nadeisha, I just want to let you know that there is a trigger warning. We will be speaking about mental health concerns during this particular presentation. So if you do need a moment, you can step away, turn off your camera, or I'm sorry, mute the audio if you need to, and just take that moment and then come back a little bit later. Okay, thank you very much. Remember, you'll have 2 times for questions, but you can always send it throughout and we'll get to them partway through the presentation and at the end. So right now, ladies and gentlemen, Nadeisha Pinnock.
Thank you so much for that introduction, and thank you to the clinic for inviting me to present today. And thank you all for coming. I hope everyone's doing well this Sunday afternoon, and we're ready to learn about caregivers, because today is about the caregivers, and I want to give a shout out to them. And we'll get into a bit more in detail around what a caregiver looks like and what we would be focusing on for the purpose of this presentation. So after this presentation, participants will begin to identify the role of the caregiver in mental health. They will also be able to briefly discuss the blessings and the challenges of caregiving. They'll also be able to identify things caregivers or supports can say to help their loved ones get help, describe the process of obtaining a Form 2, the role of, and as well as the role of the substitute decision maker, understand the family crisis support plan, describe the signs of caregiver burnout and the differences between stress and burnout. We'll also look at a way of developing your own caregiving coping toolbox, because without you, the system doesn't continue to run. So we need you to be healthy as well. And finally, participants will be able to identify resources and caregivers can access for support. So my first question is, what is a caregiver? I want there to be a little bit of engagement in this presentation. This is a safe space, so feel free to ask questions in the comments, share resources, share ideas and experiences. You can also use the raise hand feature to ask questions live. You don't have to be on camera if you're not comfortable, but I would love to see your faces and interact with you. So like I said, I want you all to think about this question. What is a caregiver? Give me your thoughts. What words come to mind? It could be one word, it could be a sentence. Let me know what you're thinking. And like I said, you can throw them into the chat. The host, Camille or myself, will definitely shout out some of those answers, or just unmute yourself and shout out an answer. As I said, we are a community here and it's a safe space. There's no wrong answer. So for me, I think of someone who's kind, someone who's giving their time, to take care of somebody, just to get it started. I have someone. Yep.
Someone said anyone who cares for someone else. That was one of the answers.
And I have one here. I think of someone who helps those who are elderly or those with disabilities and so on. Good answers. Anybody else? So again, how do we define caregiver? Because caregiver provide unpaid assistance to family members, significant others, friends, or neighbors with complex medical or mental health needs. And I'll get in a little bit of what that means shortly. The term informal caregiver has been reported to minimalize and invalidate the experiences of those providing care. This is because it implied that not only are they unpaid, but inexperienced and lacking in skills, when it's the complete opposite. The term diminishes the attention and recognition that caregivers deserve. So we're trying to move away from that phrase informal caregiver, and we're more so trying to differentiate between paid and unpaid caregiver, which I'll get to in the next slide. So as you can see from the slide, there are various types of caregivers. For this presentation, we're only going to be focusing on unpaid caregivers. And this is inclusive of a family caregiver and a support network / I use this just for definition purposes, informal caregivers. So a family caregiver is a relative who provides assistance such as emotional, financial, healthcare, social, housekeeping, and other forms of care on a daily or periodic basis for an ill or physically or mentally disabled loved one at home. Majority of the time, this is done without any financial compensation, and the family member is devoting their own time to provide support. Whereas a support network-based caregiver is unrelated to the person. It's typically a family friend or a neighbor, And just like the caregiver, they provide care typically unpaid to someone who they care about. You also have volunteer caregivers. And again, for this presentation, I won't be focusing on that particular kind because again, this is someone who's getting maybe not financial compensation, but they would be able to use it on their resume as volunteer hours, or it's through an organization of some kind. And you also may have different models of caregiving. So the first one is solitary caregiving. And this is when one family member or loved one is working alone with no other involvement. And then you have observed caregiving. And this is when one of the most responsible people providing care while others are watching. So an example would be like a mom taking care of their mother in the home, but the husband might be home or older children might be in the home, and they're more so observing rather than providing active care. Then you have tag team caregiving. Tag team caregiving is when there is more than one caregiver, but they all work individually, rotating roles and shifts. While this has some benefits, it can create challenges with what we call continuity of care. And when I say continuity of care, it means patients may receive duplicated, redundant, or gaps in care because the team is not adequately communicating. They're not talking to each other. So for example, you might have a nurse or PSW or the family caregiver working in the day, and then they go to work, and then the nurse might come in for a couple hours, but they never shared any information. They don't have a common care plan or goal. So the nurse is just going to be providing some semblance of support to maintain their safety or well-being, but there is no goal in place. So they might be doing some duplications. Simple put, someone might get bedside or washing, showering care multiple times in the day because one person didn't already communicate that the person already received it in the daytime, so they don't need another one. Or their bandages might be changed lots of times, which causes a depletion in resources rather than the individual reporting, yep, we did that already. So while it has its benefits because a person is not left to be doing it alone, like solitary, like I mentioned, it does have some redundancies. Then we have uneasy alliance. This is when there are, again, more than one caregiver, but they all have their own individual goals and styles. Similar to the tag team type, this can also result in challenges in continuity of care. And finally, collaborative caregiving is when the entire caregiving team, inclusive of family caregivers, or at times all family caregivers, are working together harmoniously. They share the same goals, have the same standards of care, and have effective communication. So now I'm going to put up a couple of poll questions. I'll wait for them to pop up here. Okay. The first question is, what type of caregiving do you think you currently practice? And there's some options here. So of course there's solitary, observed, tag team, uneasy alliance, collaborative or mixture, none, or you're not a caregiver. And then the second one is, if you scroll down, will be what type of caregiving do you want to have? And it's the same options. So I'll give you guys a moment to respond. I think we have everyone. Okay, I think we got everyone. So as you can see here, there is, we'll share some of the results here. We have, most people are doing like a mixture. We have one person doing solitary, and then most people want to do, some people want to do collaborative, and then you have one person want to do kind of a mixture of the two. And that's not uncommon. So most of the time, people want to do, a mixture, or they want to do some form of collaborative. It is technically the ideal model because again, it provides you with a sense of feeling like you have some form of support, and also it provides a pretty good structure, if I say so myself. So my next question is, what does a caregiver look like? When you think of a caregiver, what images come to mind? So again, don't hesitate, write in the comments, share. Some people might say you think of a mom or a dad or an uncle or, a nurse, whatever the case may be. But when you hear that word, caregiver, what's like the first images that come to your mind? I think I missed this one. Someone mentioned this, someone being in charge during a crisis.
Someone also said a nurse or a
parent.
teacher.
Okay, I have a female, a parent. Anything else? Okay. So caregivers come in all shapes and ages, ethnicities, races, genders. When we think of caregiving, we usually think of someone older taking care of someone the same age, such as a wife taking care of their husband, or an older person taking care of a younger person, like a dad or a mom and their child. But more and more in Ontario and in international societies, the age of caregivers are getting younger and younger. I wanted to share this video from CBC about a young person caring for their sibling, and it touched my heart, and I hope that it touches yours as well, and also gets you thinking and reshaping your vision or views of caregiving.
When people think about a caregiver, they generally think about a female. It's a very easy assumption to make and a very easy picture to paint. Watching my dad taking care of Tor has impacted me in a pretty significant way because he's shown me the other side of masculinity. To certain things and how you're supposed to take care of your family.
So I'm picking up, okay, passata sauce, pepperoni, spinach, eggs. I'll be back.
When you're taking care of a family member, the house revolves around that family member. So you kind of have to coordinate who's gonna stay and who's gonna go out because it's like an orchestra. So you have to kind of get everything in a certain balance.
Time to go to bed, Torrance. Oh, sweetheart, turn around.
There's so many little intricate details that go not into just everyday life, but into a life where you're taking care of someone else.
Jesus loves me. The Bible tells me so.
Sorry, Nadeisha, you're muted.
Yeah, sorry about that. And also I want to apologize for I don't know if you see it on your end, there's some very strange line in the presentation and I don't know how I got there. So again, I apologize in advance. But again, like I was saying, this family would be an example of collaborative caregiving, inclusive of a young caregiver. And like I mentioned before, the face of caregiving is evolving and becoming more and more diverse, especially in Ontario. Due to the strain on the health system to provide formal or for families to be able to afford formal caregiving. A lot of times we have to be depending on our own team of family members to provide support to those in need. So let's talk about data. What do the numbers say about caregiving? So in a 2020 report done by the Petro-Canada Caremakers Foundation, it states that 75% of healthcare caregivers in Canada is done by unpaid family members. The hours they work is equivalent to about $26 to $72 billion a year. And over 60% of these caregivers work outside the home. So they not only are providing care to the family members, but they also have their own employment responsibilities outside of the home. 70% of the carers are women. So therefore, the people in the group who said that when they think of a caregiver, they think of a woman, it's not surprising, because as we can see with the numbers, the ratio between women caregivers or men caregivers is quite obvious. But it's quite clear that without family caregivers, the healthcare system would suffer. However, 1 in 3 caregivers are in distress. And like I mentioned before, while majority of the caregivers are adults between the ages of 45 to 64 years of age, there's a growth in young carers. And in 2012, a research study in Vancouver found that 12% of high school students between the ages of 12 to 17 provide care to an adult with mental health needs. So that number is growing. So let's talk. I feel like I've been talking quite a bit. I want to talk to you, and I want to understand where your experiences are as a caregiver, if you are a caregiver, or maybe you've observed someone in your home as a caregiver or someone in your family. And like I said, don't be shy. As I said, this is a safe space. So the first thing is, as a caregiver, tell me about your experiences, whether it was positive or challenging, about being a caregiver. Write it up in the chat. And then the second part I want you to comment about, and in no particular order, what are some of the things you think you can say to somebody if you notice that they need help? So if you notice somebody who's struggling with mental health concerns, what would you say? So my experiences with caregiving is more on an informal or a more formal level, so nursing. So I'd love to hear the counter of that. So I see someone said challenging. I take the brunt of verbal attacks, and this individual, if you don't mind sharing, if you want to let me know who are you taking care of, like what kind of diagnosis or challenges is the individual or individuals facing, just to get an idea. Okay, so the family member has bipolar 2. Yeah, that's very difficult, and I'm sorry to hear that you're going through that. Someone else commented, when I notice that someone needs help, I offer a service rather than asking an open-ended question. Let me get you dinner, as opposed to, do you want something? Okay, that's really cool. That's a really good idea. So offering some form of tangible support. Someone commented, as a caregiver, it's challenging, but worth it. I've heard that a lot. Someone else, yeah?
Sorry, go ahead.
Go ahead. Okay, I have one more, I think. My experience was short, but during that time, it was stressful because of the disjointed communication between family members. And it was stressful finding resources. Again, very common, very common. And again, it's just because it's common doesn't mean it's okay. So I want to be very clear about that. And sorry, you were going to say something?
Yes, someone else said, I had an informal caregiving experience that was challenging. It wasn't a mental health situation, but the individual was having a hard time coming to terms with their progressing limitations.
Mm-hmm. And that's something that, of course, I'll talk a little bit about as well. This presentation is a lot more on the side of mental health, but you'll see a lot of things intersect, whether the person has a physical ailment or mental health challenges. Sometimes the journey is quite similar. And when I say journey, I mean there's usually 2 separate journeys. So you have the journey of the caregiver, and then you have the journey of the care receiver, or the person who's actually experiencing the challenge. And I'll get to that in the next slide. Thank you so much for sharing, everyone. So being a caregiver for someone with mental health needs can be rewarding, as some of you mentioned, but it also has some great challenges. And like I said before, the journey to caregiving is quite unique. You will have to prepare for a unique journey to recovery with your loved one. And they may not have the awareness to their mental health needs or be ready to access supports when you are, which means you're left to make some challenging decisions. You are called to learn about the individual's diagnosis, which can generate a variety of emotions for yourself and the person experiencing the mental illness. You may feel relief to finally have some answers. You may also feel some guilt, denial, anger, very similar to the stages of grief. You also have to understand the medications that they are taking, and most of the time reminding them to take it. And being a mental health caregiver, you wear many hats. So like I mentioned, you might be administering the medication, you might be accompanying them to appointments. This may mean providing care to your loved one by getting additional support, advocating for testing, clarifying their diagnosis, doing some care planning, treatment, recovery, resources, and rehabilitation. And also you become their advocate, their teacher, their nurse, their challenger, and their cheerleader. So as I mentioned before, you may be concerned about an individual's mental health, but they might not have the awareness or the insight to know that there are challenges. So there might not be that readiness there for them to, embark on that journey of mental health and well-being. So you might have to be the one to kind of springboard it for them. So like we mentioned in the previous slide, if you're concerned about the safety or the mental health of someone else, talk to them, give them open and ask them what they need. And then asking them not only direct service-based questions, but also with asking them direct, well-being or safety questions. How is your mood today? Are you having thoughts of hurting yourself or other people? How was your sleep? I've noticed I heard you in the middle of the night for the last 3 nights walking up in the hallway. Or, I've noticed you called me 3 days or 4 days out of the week at like 3 a.m. with all these ideas. Did you get any sleep? How have you been eating? Where's your winter coat? And so on and so forth. And sometimes it might be making a difficult decision to seek medical or psychiatric intervention on their behalf when they may not be ready to do it themselves. And this may be initiating or applying for a Form 2, which I'll get into in the next slide. So what is a Form 2? If you are concerned that a family member is at risk to themselves or others, you can request a Form 2 from the Justice of the Peace. And there are templates online that you can Google Form 2, and there's various websites that house a PDF version for you to fill out, because it would be the family member or loved one to fill out the Form 2 and make an appointment and present to the Justice of the Peace. And I'll go into those details very shortly. So like I mentioned, you are concerned about the loved ones, worried about their mental health. So you contact the Justice of the Peace and you complete a Form 2. The loved one presents the information to the Justice of the Peace and makes a case of the Form 2. And based on that case, the Justice of the Peace may sign off on it, meaning they approve the Form 2, or they might not approve and say, well, we need a little bit more information. And that can be really difficult for family members to hear, but they're asking you to take a step back and maybe review some information and bring it forward to them. So if the Justice of the Peace approves the Form 2, the order is taken to the police division where the Form 2 was signed. So you always want to try to make sure you get the Form 2 approved in an area that's nearby the person or within their jurisdiction. So if the person lives in Toronto, you'll get the Form 2 in Toronto, not in like Hamilton or Brampton, because it's not within the jurisdiction. So now once this is approved and is received, the police have 7 days to execute the Form 2. And when that happens, the person is now the police is now given permission with the Form 2 to pick the person up and bring them to the emergency department. So like I mentioned, this Form 2 is only giving permission for apprehension. It's only giving the police permission to pick up the person and bring them to the hospital. It doesn't give the hospital permission to detain the person. So when the person gets to the ER, a physician, whether it's the ER doctor or psychiatrist, will do an assessment on the mental health and well-being of the individual. And now if the doctor determines that the person is okay, and maybe they'll say, like they're not at imminent risk, we're going to release them from the hospital, but they may schedule an appointment with the psychiatrist at the outpatient program attached to the hospital, or they may recommend that you make an appointment with their family doctor for them to be seen. Now, if the doctor assesses and feels that they are of concern, the person will be placed on a Form 1. And a Form 1 is a 72-hour hold where we can involuntarily detain a person for further assessment. This Form 1 does not allow doctors to force treatment on someone. A person can still refuse treatment even though they are being detained for the 72 hours, but it does allow the doctor to do a little bit more of a deeper dive, so to speak, of the person's mental health and well-being, and be able to determine what further supports this individual could benefit from. So just a little deeper, a closer look at the Form 2. So this is how it looks like. So up here, you would place the name and address of the person applying for the Form 2, and then you would place at the bottom here the name and address of the person needing help. Or if you know it, it's ideal if you know it, or the best place to find them. This area here, you complete this area if the person is able to make their own healthcare decisions, so they're capable. You would just tick all the boxes that apply. So the next page is the section B, and that part you fill out if the person is not capable of making decisions. Your loved one, for example, may have a mental health diagnosis. You may know that they've received treatment in the past, and you know that they get better with treatment if they stick to it. And if they're not treated, they may cause harm to themselves or harm to others, or they're not being able to care for themselves in a way that puts them in danger. And I just put some examples here in terms of lack of competence to care for self. So for example, wearing shorts and no shoes in the middle of winter, not eating or drinking, or maybe even overeating to the point where they get really sick, not being able to sleep at night for days, locked in their room for long periods of time, refusing to connect with others, self-isolating, hoarding. Those are all examples of decompensation, as we call it. So we have here, so as I mentioned. So this is the next part of the Form 2. Again, you're just going to tick off all the boxes that apply. And then you're also going to provide what we call further information or supplementary information to further argue why you checked those boxes. So a rationale. Some of the things that you might provide for them is, if the person already has an existing mental health diagnosis, if they have a mental health history, if they've been to hospital before, where did they go, how long did they stay, any changes in behaviors. So for example, if you know they stopped their medication, or they're threatening suicide, or they're threatening to harm others, or again, other tangible signs that they're no longer able to take care of themselves, not paying their rent, or if the landlord may have complained, like all of a sudden the place is flooded, or there's multiple reports of them leaving things on the stove and forgetting about it, and there's fires. It's bringing all of that information to present to the justice of the peace. And you can do this in writing on this page, or you can present it verbally. I personally recommend writing it down, because when you get into the justice of the peace, you might get a little nervous, or you might feel rushed and you might forget things. So it's always good to have a paper trail of information to provide them for them to review. And then once that's done, the form must be sworn in or affirmed, which means that you promise that the information in this form is true, and then you sign it in the presence of the justice of the peace. And then the justice of the peace will sign it as well with their approval. So in the event that the person goes into the hospital, they went on a Form 1, they're detained for 72 hours, the doctor may keep them even longer than 72 hours, maybe 14 days or more. And that's another form that I got into. If you want to check back in the first presentation that I did, you'd be able to review the different forms of the Mental Health Act. And that form was called a Form 3. But if all of that happens and the doctor makes an assessment, and then they realize this person is not capable of taking care of themselves or making decisions based on their treatment, the person may be deemed incapable and given a Form 33. So the Form 33 is given to a patient anytime the patient deems them incapable to consent to treatment, manage their own property, or manage the collection and release of their own health information. Now, the person, once they receive this Form 33, may try to appeal it. They get to speak to someone that we call a rights advisor. And this person comes to the unit and they would explain to them, this is what this is about, and you have the right to appeal this or argue it against the Consent and Capacity Board. So the person would make an appointment for a hearing. They would present to the board and state their case as to why they don't think they should be deemed incapable. So this Form 33 only lasts as long as they are inpatient. There are other formal processes, such as a community treatment order that could be issued to an individual once they are discharged in an outpatient setting or in the community. And I did discuss that in a lot more detail in the last presentation. So please check on the clinic's website for the recording if you need that review. So now, based on the age of consent, so a person is capable of making consent and making decisions around their treatment, no matter what their age is. We don't really use age per se. I use a little asterisk beside that to determine ability to make consent. However, age can and should be taken into account by a healthcare practitioner when assessing capacity and when assessing if they're capable. So an example might be if a person is like 5 years old, or 4 years old. They may understand some of the information that they are receiving, but they would not understand or appreciate, based on their developmental level, the consequences of refusing treatment or the consequences or the risk and benefits of accepting treatment. So usually a family doctor or psychiatrist will look to their parents as substitute decision makers. And I'll get into substitute decision makers shortly. But as an individual ages and matures, this ability for them to make decisions is placed more so on the person, more so than their formal caregivers like their parents, except, of course, if there is a diagnosed intellectual disability or delay that may, again, make them incapable of making decisions. So once a person hits the age of 14 years old or older, they can be made incapable and they can be given a formal appointment with a rights advisor in any psychiatric facility in Ontario and Canada. So I know this could be a very hot topic for parents, because especially if they're going into a mental health facility and they're bringing their young person in for help, and the doctor says, well, we need to speak with them alone. The family's like, what do you mean speak with them alone? I'm their parent. I should be there. But it's recognizing that once they're at this age and are deemed capable to make decisions, we now treat them as an individual entity. So then we want to make sure that they are involved in their treatment and able to advocate for their treatment as much as possible. That doesn't mean that the doctor should not take your report as a parent or caregiver into account. There should be some opportunity for you to share your observations and assessments of the loved one to help inform the psychiatrist or doctor's decision. So we'll go into the role of the substitute decision maker, or SDM for short. So simply put, the SDM makes treatment decisions based on what will be within the best interest of the patient. Best interest can be determined by a number of things. So one, it's referring to the patient's values and beliefs when they were capable. So for example, a person may have made a care plan before they were made incapable, or they might have an advanced care plan or treatment plan that shares some of their wishes. So you would want to take some of that into account, or all of it. The SDM also determines the treatment being offered and also looks at, will this treatment improve the patient's quality of life, prevent relapse or deterioration of the mental health, reduce or slow down the rate of deterioration. On the flip side, they also determine the consequences of not allowing the person to receive treatment. So will they get worse if they're not given this medication? What would their quality of life look like if they weren't getting that extra oxygen or being able to go to this facility? And finally, do the benefits outweigh the risk of getting or not getting the treatment? Also, are there other options that can be less intrusive or restrictive that will give similar or better results? So SDMs have to step into the shoes of the patient and make decisions on their behalf about treatment, possible admission to long care facilities or intensive mental health treatment programs, and personal care. So this sometimes would include making decisions around their finances, their safety, housing, and nutrition. SDMs in Ontario are appointed by using an SDM hierarchy. So family members are the highest on the hierarchy, and family members would look like spouses, parents or children over the age of 16, siblings, and then other relatives by blood, marriage, or adoption. So like cousins, an in-law, an adopted, child, or so forth, and that's how it goes. If there's no family, or the doctors or anyone determines that the family members that are available are also not capable of making these decisions, the Office of Guardian and Trustee is appointed, and somebody's chosen from that Guardian and Trustee office. If the person has an advanced care plan where the SDM is identified, that person would be given priority over everybody else. This plan would have to be made while the person was capable. So an advanced care plan mentioning an ideal SDM couldn't be made when the person was already incapable. So in terms of a good resource for further information and an FAQ, Speak Up Ontario is a great resource. It consists of commonly asked questions about SDMs, inclusive of the advanced care plan, that I encourage you to go on their website and review. And at the end of this presentation, you should be receiving a kind of like a resource package where Speak Up Ontario is included on there, and their website information. So this is an example of a safety plan aimed at caregivers and their loved ones. I wanted to share this resource with you, and it's also included in the package that you'll receive after the presentation. It's a good way to have it's a good idea to have a safety plan that is ideally agreed upon by family members and the person with the mental illness. So they should definitely be involved in the care planning and safety planning process. You could get as detailed on this plan as you'd like, such as identifying specific coping tools, helpful or unhelpful triggers, people, things, locations, dates, contact numbers, and so on. Phone numbers of people that would be helpful to the individual, formal or informal. And then as well, it's a very clear plan. If we see that you are not doing well, these are the things that we're going to do. And you can use the back and the front. You can add extra sections on here, and you can hang this somewhere where everyone can see. So everyone being the family member, that is. So, some people may put it on a fridge, or they might put it on a door in a room, or may have it in a little folder on a coffee table or something. The point is that you want it to be very clearly communicated to all caregivers involved. So now we've arrived at a break, and feel free to go ahead, stretch your legs, and I'm going to pass it back over to our lovely host and individual who is taking all the questions.
Thank you very much, Nadeisha. If anybody has any questions, now is the time to send them through. If you don't have any questions right now, or if you want to wait, you can also ask questions again at the end of the presentation. So right now, just wait for a minute or two, just to see if anybody has any questions.
Okay, well, enjoy your break.
So we will have about a 5-minute break, and then Nadeisha will start again. So we'll have some music playing, and then again, when Nadeisha comes back, we'll start off the second half of this program. Thank you, everyone, for coming out. Hello, 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 everyone. Thank you again for coming out on this Sunday afternoon to our program, Caring for Others While Caring for Yourself. It's a much needed topic, a much needed conversation that needs to be had. And right now I am going to turn the conversation back over to Nadeisha, but just before I do, reminding everyone that if you have any questions or comments, that you can send them to me. As you see in the chat, my name is Send Questions Here. So questions/comments, I can change it to that as well. Or you can send it directly to Nadeisha, who is our program facilitator for today. Thank you so much. And again, I'm going to hand it over to Nadeisha.
Awesome. Thank you. I'm not on mute, right?
No, you're good.
Awesome. Okay. So we're going to talk about stress versus burnout at this point. And, like previously mentioned, caregiving can be very rewarding, but it can also be very challenging. At times, caregivers are juggling a lot and it can be very stressful. However, how do we differentiate stress from burnout? Stress and burnout have some similarities, but there are some things that set them apart. And we'll go through some of them in this comparison chart that I will put up just now. So first, comparing stress and burnout, think of too much versus too little. So stress is when you're in overdrive. You are responding to a demand or stressor at varying intensities. It's an increased pressure at work, school, home, and so on that can be physically and emotionally challenging. Stress in short stints with clear resolutions can be seen as positive. So for example, if you're studying for a big test and you pass, right? It's really a time, it's a time limited experience. Burnout, on the other hand, is too little, when there is no end to a stressful situation and it results in feeling low energy, low motivation, detachment, apathy, which is no longer caring about a situation or a person, and other serious physical and mental changes. You can see how these symptoms can negatively affect the caregiver and the person receiving care. It can result in neglect, conflict, and serious errors that can lead to injury. So when I'm comparing burnout, when we're talking about burnout, I'm going to use this imagery. Think of a jug of water. If you keep pouring out the water without replenishing the jug, soon there'll be nothing left. And to refill it will take time, especially if you're pouring it out while trying to fill it up, right? If you get a jug of water and you're pouring it out and filling it, it's never going to reach to the top. So think of burnout in that way. So here's a closer look of the signs of caregiver burnout. What does it look like when your jug is approaching empty? So we're going to talk about the physical, emotional, and behavioral signs. So in terms of physical signs, you feel tired and drained most of the time. You may have lower immunity and frequent illness, so you might find you're catching a cold a lot more, frequent headaches and muscle pain, and changes in appetite and sleep pattern. Some emotional examples would be sense of failure or self-doubt. Am I doing this right? Imposter syndrome is another really big one. Feeling helpless, trapped, and defeated. Detached or feeling alone in the world. Loss of motivation, negative outlook, and decreased satisfaction and a decreased sense of accomplishment. And then finally, behavioral, withdrawing from your responsibilities. So maybe getting up later and later, you know you're supposed to do the morning care. You're supposed to be giving the person their morning medication or reminding them. You're supposed to be reminding them to eat in the morning with their medication. And you find yourself dragging yourself just a little bit more each time. And then you might have isolating from others. So you might be diving so much into your caregiving duties that you now are isolating yourself from your peer or social group or support group. Again, procrastination. I have to make these appointments, or I have to make this, go to the pharmacy, but you're putting it off and you're waiting to the very last minute to get these things done. Using food or drugs or alcohol as a coping strategy. Taking out your frustration on others. So you might find you have a very short fuse or short temper, or it might be skipping work or coming in late or leaving early. It's just an overall changes, drastic changes in your usual routine. Another way to look at burnout is examining the stages. So burnout falls more on a continuum. And if we use that jug analogy again, your risk of burnout is dependent on how quickly and efficiently you are refilling the jug. You can flow across each stage depending on a variety of things, such as time of year, access to resources, life changes, and so on. The goal is to return to a space of balance and harmony versus staying in the state of struggling and or empty jug. So think of struggling as the empty jug, part of the jug, and harmony is when your jug is full. So you might find that you might get, lower and lower in depletion, and you might be falling into the juggling stage, and you're just like, oh, I kind of need to figure out how to get myself back to balancing and harmony. So how do you do this? The key thing is to remember the 3 R's. Recognize the signs of burnout. Watch out for those warning signs. Do level checks with yourself. Where is the water in your jug at this moment in time? The next R is to reverse the damage that you recognize that is happening. So finding ways to fill the jug. Seek out formal or informal supports and utilize your personal coping tools to manage stress and prevent burnout. Finally, it's building resilience to stress, but creating a self-care routine. Every day, check in with yourself. Every day, it should be a part of your routine to do a level check. Ask yourself, what did I do today for me? How did I make sure that my jug is not diminishing and not being filled back up? So if you recognize that you are on the way to burnout or struggling with mental health concerns, the first thing you need to do is reach out to someone, whether it be a close friend, a family member, your manager, colleague, or professional. Don't isolate. I'll get into resources soon, but there are a variety of in-person and virtual supports for caregivers of all ages that can be accessed. Next, ensure your basic needs are being met. Check if you're getting enough sleep, exercise, make sure you have a balanced diet. The next thing is to identify triggers or causes to the stress. What is affecting you the most? And can you rid yourself of it? And then reframe the way you look at a situation. Cognitive behavior therapy is a good way, and it's a great therapeutic model that can help with this. So in a nutshell, CBT, or cognitive behavior therapy, encourages you to identify negative thoughts, which feed into negative feelings and then negative behaviors. It's almost like a feedback loop. And the goal is to break the loop by challenging and examining the negative thoughts and replacing it with more balanced thoughts. So this isn't as simplified as, oh, think happy thoughts or be positive. It's literally examining the thoughts that you're having and figuring out, okay, how can I switch these up? And what evidence do I have that's feeding into the negative thought or not feeding it into the negative thought? And how can I reframe it and look at things instead? And the goal is it's supposed to result in a balance of feelings and behaviors, which then will, feed into each other. And again, get to that, as we talked about before, that continuum of burnout, it's getting to that stage of balance. There are counselors in the community who are trained in CBT, so you can learn more about it if you were to connect yourself to a psychotherapist or a counselor in the community. Finally, it's reevaluating your priorities. What is important to you and your family? Is there a task, a need, or a want? So sometimes we get fixated on what we want, that we get like tunnel vision. So sometimes it's taking a step back and asking yourself, does this have to be done right now, this second? What are the consequences of not doing this thing at this very moment? So for example, you have a child and you might have engaged them in a social group of some kind, and the child doesn't want to go. And they're putting up a fit and they're fighting you against it. I don't want to go today. And it's thinking to yourself, is it worth the fight today? Is there something else that we could be doing? Is it really listening to the child's needs and saying, okay, let's talk about it. What could we be doing instead? And perhaps they just need a break, just like you might be needing a break. Because just like caregivers, care receivers can burn out too with all of this go, go, go in their routine. So it might be looking at maybe we all need a break today and assessing that. So like I mentioned in the previous slide, having a coping plan is essential for caregivers. It can be an actual box, which I encourage, or just a crisis support plan on paper. And I'll give you an example of this on the next slide. So some of the things you want to do is you identify items or activities that encourage self-care. And over on the slide, I gave some examples, but my personal favorite is what we call the Damn It doll. You can actually buy one of these in the store. I have one in my office at work, and my team would use it to release frustration. And I must say it's effective. And literally, it's just Googling Damn It doll. And it just looks like a little rag doll. And when you're upset with, you can go into your room, you can grab it out and you can just slam it everywhere. And sometimes screaming damn it with it helps even all the more. If you're not into the damn it doll, you're not a damn it doll type, think of other healthy things that give you a release or create a sense of calm. Bubble baths, going to the movies, taking a walk, doing yoga, using essential oils, and so on. The next is identifying a social network and supports. Who is on your team? It could be friends, it could be an online forum, a Facebook group, a weekly support group, in person or virtual. It's important that you make attempts to maintain those supports. In the resource package, I provided some examples of support groups you can access as well. Accessing your own emotional supports is also a good idea, like I mentioned before. So education groups to increase your awareness and understanding of what you are dealing with or supporting. Family counseling and or one-to-one counseling can expose you to resources in the community or within yourself that you can access, or maybe you didn't even know was there. It gives you a safe space to explore your own needs. And also remember to use technology to your advantage. Like I mentioned, there are online groups, there's texting kind of engagements or what we call forums where you can use your phone and just text. You can find a counselor virtually as well. So it's really using the technology to your advantage and knowing that nowadays you don't technically always have to leave the home to get the support, even though I would recommend face-to-face counseling. Remember to practice the coping strategies you learned in counseling or through personal reflection. And just like any skill, you can't master it if you never access it. So it's thinking about, okay, if I want to learn to swim, you go into the pool one day and then you might kick around a bit and then you don't go back for several months. You can't expect to now be a master swimmer. It's just impossible. You're not going to be ready for the Olympics. You have to practice every day. You got to take it a step at a time. And it's the same thing goes with self-care. It's practicing it and embedding it into your routine. An example would be journaling. So if you are wanting to get into journaling, it's setting a tangible plan for yourself. You can journal once a day, you can journal once a week, every 2 weeks, you can do little bits and pieces. There are apps available that allows you to journal wherever you go. You can also use voice note features on your phone to express your thoughts and feelings on the fly as well. Again, some people benefit from tangible items like the Damn It doll. Also engaging in childlike play is shown to be therapeutic for some. So going on the swing, competing with each other to see who can pump up the highest, blowing bubbles, skipping, playing hopscotch, all with the aim of distracting yourself and reducing a crisis. So here is the example of the Caregiver Crisis Support Plan. This one is for you, the caregivers, right? And like I mentioned in the last slide, this is a good way to have everything in one place. You can put it in your coping box with your other tools, on your fridge, on your mirror in your room, or whatever else you have easy access to. Just remember to use it and change it as you learn about yourself, what you need, keep the context on here current and so on. So it has some key questions, like, for example, the signs of burnout. You check whatever is applicable to you on a regular basis. So if you know this is something to show like, okay, I'm burning out, check mark them and also list anything else that's not included. Things you could do to calm yourself down. Again, it's checking these boxes. And like I mentioned, things may change over time. So maybe at some point, taking a warm bath was really therapeutic. It was really helpful. But nowadays, it might not be so helpful. So you might pivot to something else. You might change it and you might find new activities or ideas based on those support groups or family groups or therapy that you're engaging in, and you might include them and write them here. Don't be shy to cross things out, write something to anew, make copies of this, and you might have, you know, different copies for different times of the year. So like I mentioned before, burnout can be triggered by times of the year. An example would be during the winter months where you might not be able to go outside as much. It might be a lot colder, or it might have a lot more snow days where you're left inside. So that coping plan might be very different than a bright sunny day where you might be able to bring your individual out for walks and be busy and out and going. Those things might change. And if you notice here on the left-hand side of the handout, you notice my safe spaces. This is to identify either in your home or outside your home where you can go if you need a minute. Sometimes it's a little of a controversial term, but in my experience, we would call it a mad minute. Meaning, if I don't get this minute, I'm going to lose it. And I need that time to bring myself down and so to speak, kind of fill my jug just a little bit to be able to manage the rest of the day. And where would that safe space be? It might be in the bathroom. You might go into the closet. You might be in your bedroom. If you have a balcony, it might be going on your balcony. It might be going in your car. It might be walking the hallways or sitting in the stairwell if you live in an apartment. So it's identifying those safe spaces. And then also, as I mentioned, is mentioning your support team. So if you have a therapist, if you have a really good friend, you know, you can call at any time of the day or night or text. It might be your family doctor. It might be your pastor or your priest or your spiritual guide or your coach, your naturopath, whomever. You place them here with their name and any other contact information, email, phone number, so forth. And then this final piece is resources where you can get help. And usually when I say help, it's more so immediate. So as I put here, the caregiver support line, you might want to put a local crisis distress line. And I didn't add that here because at the moment, there's no Ontario-wide or Canada-wide crisis line that can support the entire nation just yet. But there are local regional ones. And if you go to distress centers of Ontario, you would be able to find your local number that you would call. Family doctor is a good one. The individual psychiatrist might be a great number to put here if you're feeling frustrated and need some extra direction. If the student is attending school, it might be like their guidance counselor, so on and so forth, to give them the heads up that there's something going wrong. But it's putting all the contacts here, and you can use it back and front if you need extra space. And in an event of emergency, it's saying to yourself, I will call 911 or go to the nearest emergency center. And that might be taking the individual in need of help with you to the emergency center for support. And the one thing that I will say that is not on this coping plan is to remember that you're doing your best. And that's all you can do. Every day, in and out, you are with this individual more so than most people. And it's giving yourself that recognition and understanding that there will be good days and there will be bad days. And this is why you're creating a coping plan of this nature. So there are a variety of supports out there to help caregivers. And I'm aware that there are barriers to accessing some of these services, such as hours of operation, cost, and so on. It takes time to find the services that suit your need. Although it can be a bit of a work upfront to find those supports, it is beneficial to create a support team in the long run. And if you're feeling overwhelmed, Ontario Caregiving Association may be a good place to start, and you can call that helpline that I listed on the crisis plan. And they also are great at system navigation, meaning you can call them with a need or a concern, and they can direct you to the support that they feel might best suit what it is that you need. So I just gave some examples of different kinds of support. So there are respite services, and respite services can go all across the lifespan. So it could be a young little person, or it can be an elderly person that you need support with respite. And there are funding options available that you can apply for. I believe some of them are lottery and some of them are first come, first serve. But my suggestion is if you don't apply, then you don't get it. So it's applying for as much as you can and being aware of. The Province of Ontario website also has some good resources on funding, depending on what it is that you need. You can also connect with your family doctor or psychiatrist or local outpatient facilities, and they may be able to direct you for maybe not direct financial support for the individual person, like to help with counseling per se, but there's other things that they might be able to, you may be able to access for financial support. An example I can give is Carrie's Place, as well as there's another organization called Every Mind. So Every Mind has a respite service for children and adolescents, and they're located in Peel region. And it's for children and adolescents with mental health concerns. And they have a multi-pronged model. So what that means is one of them might be them assigning a respite worker that may come out once or twice a week for a couple of hours to work with the young person, whether it's literally just taking them out to play basketball, going for a walk, similar to Big Brother, Big Sister. But some of the caregivers there may have some expertise as being a child and youth worker or behavioral support worker. So they may have that little extra expertise that they can support with. Recognizing the long wait times, Every Mind also created, there's two other models with care giving or respite support. And it's that they may give you funding or allow you it's for 6 months at a time to assign or pick someone in your community as a formal caregiver. So an example might be someone you know that's a good male role model, for example, and may have their own credentials. And you think, okay, maybe if we give them the money, they can be the caregivers or support once a week for about an hour to take the student out and so on and so forth. So the organization will allocate the funds to that caregiver to provide them with that support. Again, it's time limited, but it's still much more appreciated than not having any support at all. And then finally, they do have parent run or organizational run homes where the individual can go or the child can go to the homes about once a week or so on. There is usually a buildup over time on how long they can stay. The family may have excursions, go to parks, so on and so forth. And they are vetted by the organization. So that's just an example of example of respite. Another informal type of respite is enrolling the individual, if they're children, of course, into a day camp. And you can apply to various kinds of funding support within your city of Toronto, the region of Peel, Durham, et cetera. They have funding supports attached to their recreational or community support services called in Peel, for example, it's called Active Assist. I'm not sure the name in Toronto, but you would be able to apply for funding and they can assist you with paying for the individual's camp. YMCA also has some funding and financial support that you can apply for, and then you have Canadian Tire Jumpstart. There's also adult daycares, like if you have an individual who's aging and also has a serious mental health concern, you can apply for those daycares as well. And again, I just want to stress that I am aware of wait times and so on and so forth. And that can be very much a barrier to accessing those supports, but I'm just letting you know what's available out there in terms of options. Another thing that is a good opportunity is caregiver meetups. And it's kind of like a play date, so to speak. So a bunch of caregivers come together. They may make a plan to say, we're all going to collectively go somewhere together. It could be just the park next door. It can go to the local zoo or the aquarium, wherever. And at least you have that kind of backup support of someone who knows what you're going through. So if your individual is running off or they're not listening, it's a good place to have someone to vent and connect with. And you can also schedule just meetups with your caregiver, with the caregivers in question. And some of them create what we call a round robin approach, which means that, okay, this week, one person is going to take care of a couple of the kids and we'll go out. And then the next week we'll rotate. So that's also a great option as well for people who might not have the financial means to get a formal caregiver in the home. It might be finding the local caregiver meetups and caregiver support teams and seeing how you can navigate that as well. And lastly, I leave you with this short list of other resources. Take a screenshot if you can, and you can always refer to them in the future. The Mental Health Commission of Canada also created a really great list of supports on their site as well in commemoration to Caregivers Day, which was April 8th. So take a look at that link below, and you can see that they also divided it based on the province in Canada, and you can see whichever one might be a good fit for you. I'll just leave that on for a second and see if you guys want to take a screenshot or write some information down. So that's it for my presentation. I hope that you walk away feeling a little bit more informed. And if you have any questions, please, now is the time to ask. Feel free to drop them in the chat, or there's the raise hand feature like mentioned, and we can unmute and you can ask the question live.
So I have a few comments. One is great presentation. Another one is great presentation. Thank you for sharing your knowledge, Nadeisha.
No problem.
So it's more shout outs and congratulations to you. Yes, it was a wealth of knowledge that we have here in our community. And I appreciate you for taking time out of your busy schedule to put this presentation together and share it with us. Okay.
It's an honor. Thank you so much.
No problem. Are there any questions on your end? Nadeisha, does anybody know? Okay. Oh, I have another comment. Thank you to the clinic for facilitating this. You're welcome. Yes, we're just out here trying to forward and help our community in any way that we can. And I'll just get Nadeisha or whoever is taking care of the presentation right now to put up that last slide with Nadeisha's information. Perfect. So thank you everyone again for coming. If you would like to get in contact with Nadeisha, she is right now available on Instagram at Pinnock, MH Consulting. That's Pinnock, MH Consulting. Is there anything else that you want to add, Nadeisha?
Sorry, I was on mute. Again, my website will be up soon. But for now, Instagram would be the best bet. And please, if you rewatch this presentation or you watch the first presentation and you have questions, don't hesitate to shoot me a DM. If you have any questions regarding the Mental Health Act, again, don't hesitate to send me a direct message on Instagram. You can also send me an email at nadeisha.pinnock@gmail.com, and I'll put that in the chat in case you have any mental health related questions. And like I said, my website will be up soon. My apologies for that delay, just trying to get everything up and running. But again, thank you so much for everyone in participating and tuning in on this presentation. I really appreciate it.
All right, thank you very much again. And I hope that everyone has a great Sunday afternoon. Kick your feet up if you can, relax, do some of those self-care suggestions that Nadeisha spoke about. And we will see you at our next clinic. If you guys want any information in regards to the clinic, you can also go to www.thepublicclinic.com, and I'll put that in the group as well for everybody to see. Okay, thank you and have a great afternoon.